Welcome to Focus Today. I'm your host, Perry Atkinson, and well, here we are in the winter months, and I don't know about you, but maybe your skin's a little dry, especially if you have a wood stove in the house. I don't know if you're putting the teapot on there and keeping a little humidity in the house, but just in general, we haven't had any rain until lately, and things have been a little dry. So I'm delighted to have back in the studio. It's been quite a while since we've had Dr. Jennifer Childers with us. She's with Ventana Wellness, and we're going to talk about dry skin. So it is a problem right now.
It is. It actually is a problem here most of the year because the climate generally is pretty dry. But there's definitely an uptick in dryness in the winter months.
All right. So is it more in the winter months than the summer months?
Oh, yeah. Well,
really?
yeah. Oh, yeah. Here it is. Well, as soon as you turn your heat on in your house, you know, the skin starts drying out, and it's mostly because people have dry heat, and you know, you just talked about wood stove and stuff like that. People have dry heat, they enclose their house, and so the houses have, you know, whatever contaminants and everything that are in the house stay in the house, and all of those irritants along with the dryness then really starts acting on people's skin.
All right. So what do we do? I mean, do we run out and we put lotion all over us? Do we eat different? Do we drink more water? Where do we start this treatment?
All of the above. But basically what you have to do is you have to take care of your skin just like you take care of, you know, anything else. So, you know, you do have to drink more water. One of the things that's really important as far as diet is concerned is to eat more good fats. And I know that everybody, you know, like just like you, oh, it's surprising. But in fact, your skin is almost all fat. I mean, the cell walls are all fat. The absorption of the skin, you know, all the nutrients and everything are fat. And so in order to make good skin cells and for them to be able to hold the moisture in, you need good fat. I mean, you think of your skin like a brick wall with mortar, and the fat, you know, really is the mortar. So if you start letting it crumble, then the moisture escapes and your skin doesn't do well. So eating more good food with fat in it, the good fats like fish oils, nuts and seeds, avocado, artichoke, coconut, those foods have got really good fats in them. Plus putting coconut oil on your skin, which is a super good moisturizing and agent, and it can be used directly from the skin. It can be used in order to make better skin cells.
Well, there you go. All right, so I just put some hand lotion on before I came in the studio because I was dry, and it's amazing how much dryness we experience during this time of the year. But is there a difference in types of dry skin?
Oh, absolutely. You know, I mean, there's just basically winter skin, winter itch, which basically is just dryness from, you know, normal people's skin dries out in the winter, but then some people, especially if they have a little bit of hereditary predisposition, or if they have especially bad diets, or if they have other medical conditions, they can develop things like nummular eczema, and then there's an atopic dermatitis, which is, you know, there's a hereditary component, but is made much worse by you know, dryness and the weather. And then there's a lot of other conditions in which basically yeast organisms on the skin, because of the dryness, will dive down in the hair follicles and create a folliculitis, which is a really bad, itchy, irritant condition. And then we have a lot of people around here who spend time in hot tubs. And the hot tubs will dry your skin out tremendously too, not only because of the chlorine in the hot tubs, but also because if there is any bacteria that gets in the hot tubs, then those bacteria are circulated into your hair follicles, which tend to be more open because you're in the hot tub and the water, it tends to open your hair follicles, so you end up getting a folliculitis that way too.
Is there a difference between dry skin and eczema?
Yeah, oh yeah, absolutely, yeah. I mean, dry skin, you know, like you said, you felt like your hands were dry.
Yeah, well, they were kind of cracky.
And cracky, but they weren't actually itching.
Not there, but here they are.
Okay, all right, okay. So, you know, when it moves into eczema, though, I mean, you really get that itch component, and the itch can be extremely severe.
Yeah. So,
eczema, when you really move into eczema, so eczema, dermatitis, same name. Basically, it's like having poison oak, poison ivy, whatever. Mm-hmm. You have poison oak here, but basically it's that same thing. So it's really an inflammation of the skin created by, you know, the conditions that occur. And dryness actually can either start the condition or it can snowball it. In other words, you can have the basic, you know, hereditary condition, and then the extra dryness can then just send it into, you know, overdrive. So sort of like a snowball rolling down the hill.
All right, now there's a ton of lotions out there, and I don't know,
absolutely.
how do you look for a winter lotion like you do with a summer sunscreen? I mean, are there numbers? What do we look for here?
Okay, there are no numbers. Okay, so basically what, I think coconut oil actually is like the best moisturizing lotion that there is. Now, it's not a reasonable thing to use like just during the days to put on your hands, as you go. But there are now, we now actually have a pretty good understanding of the makeup of the skin cells and what's necessary. So the most important thing is ceramides, which are the fatty acids that are in the skin. And then there's a protein component, and there are some mineral components. And so there's a couple of lotions out there now that are actually designed to replace and to repair those particular components that are necessary for good skin function.
Go ahead and name them.
And so, well, the Cetaphil company makes one called Restoraderm,
okay.
And the CeraVe company. CeraVe is a newish, I guess, company that's been making a lot of different lotions, and they make one that contains the B vitamins and the ceramides and stuff like that. One of the old standbys, actually, Aveeno, the oatmeal formula. Oatmeal, who knew it, but oatmeal actually has a lot of the components in it that are necessary for skin repair. I mean, people knew that oatmeal helped soothe skin a long time ago, for chicken pox and whatever. But the Aveeno formulas with the oatmeal is also a repair formula, basically. So so there's a difference between just a moisturizer, which just kind of sits on your skin and sort of just forms a barrier, and then there are skin repair lotions or skin repair creams or skin repair products, and they actually help repair the skin barrier so that the moisture doesn't escape and the cells are healthier.
Because you'll see such things like vitamin E added, you'll see aloe vera added. I'm trying to think if I ever seen with coconut oil. I guess it's there. I just didn't look for it. So
coconut oil is in some, but just using plain coconut oil actually is
the way to
far
go.
more effective. Well, okay, so this is the thing. Your skin basically renews itself or repairs itself about every 3 to 4 weeks, depending on your age and some other factors. And if you are a regular coconut oil user, like after your bath or shower or something like that, if you use it on a regular basis for a period of 3 or 4 weeks, it actually, by the end of that 4 weeks, your skin is actually better. So it's like that mortar with the brick wall that I was talking about before. It actually repairs, so you go in and it actually repairs a lot of the damage that's done to your skin. It actually has some DNA repair characteristics to it. So the capric and caprylic acid and the lauric acid and stuff in the coconut oil actually repair. It's really a major, and it's very inexpensive. As I said, it's not really necessarily easy to use it, all day long, because it's, comes in a big jar and it's greasy and whatever, but it goes in pretty quickly.
Does it? Okay.
About 10 minutes.
All right. Now, you mentioned earlier hot tubs are obviously a problem primarily because of the chlorine. What about just good old long baths and hot showers?
Yeah, they're a problem too. In this time of year, it's taking a long hot shower, especially.
I love them. I love them.
Especially if you allow the shower nozzle to pound on a particular area. There's a particular area in people's backs, right in the middle of the back here, where a lot of people itch. And they come in, they just itch and itch and itch and itch. And one of the reasons that they itch there so much is because they let the shower pound there because it itches, and then they can't moisturize it properly because they can't reach it.
Right.
And so that area dries out tremendously. And there's actually a name. There's actually a name for that condition, in the dermatology literature. Because the skin gets thick and it gets lichenified, and it's abnormal. And if you biopsy it, they call it localized amyloidosis, and it's because of this constant dryness and then repeated pounding with hot water on it. So, not a good idea.
Okay.
So you should move it around, and you should try and shorten it anyway for just for good environmental stewardship. You should shorten your showers. You shouldn't take too hot of showers. And actually, this time of year, if you're not actively participating in, some sort of, exercise activity and stuff like that, you can even go every other day taking a showers, or even every 3 days. The older you get, the harder it is for your skin to repair itself, and the more the moisture tends to leak out.
All right. Well, if you're experiencing some dry skin, you may want to check out Dr. Childer. She's an MD and a PhD internist and board-certified dermatologist at Ventana Wellness. When somebody comes see you, when a condition, you know, the dry skin and the itchy and spots and breakouts, when should they come see you?
Well, I mean, I guess it depends when it starts bothering them enough and they really feel like it's affecting their lifestyle. You know, if they're having, you know, issues where they can't sleep, or, you know, they're scratching themselves so much that they're actually getting maybe like secondary infections in their skin and stuff like that, obviously not a good thing.
All right. Come see them then. All right. Well, thank you. I think we need to be aware of this, because if it's not properly treated, what's the ultimate problem? What happens?
Well, it's the secondary infections that are the problem, because your skin gets really dry, and then, you know, you scratch and you itch, and then you get infections. You get cellulitis, bacterial infections, and then the skin, you know, then you end up in the hospital, and, you know,
well, you can do that.
IV antibiotics, and sometimes, you know, that kind of thing. So, plus the fact that, you know, you're just not, it's not a good way to live to have, you know, moderately or severely dry skin.
Okay. Thank you, doctor.
You're
welcome.
welcome.
Coming in. All right. Again, she's with Ventana Wellness. You may want to check that out, and you can catch them at ventanawellness.com. All right, we'll take a quick break. We'll be right back.